Let's talk about the fear surrounding hormone replacement therapy. It really began in 2002. Before that, actually, a lot of women were taking hormone replacement therapy throughout perimenopause and menopause. And then in 2002, the Women's Health Initiative, it was a large study looking at hormone replacement therapy, came to a screeching halt, and they said they had to stop the study because they found that women who were taking estrogen and medroxyprogesterone, so not a bioidentical progesterone, but a synthetic one, had an increased risk of breast cancer of 26%. So, of course, across the world, almost all healthcare providers stopped providing hormone replacement therapy, and most women stopped taking it. And instantly, women became afraid, and rightfully so, that if they started taking hormone replacement therapy, their risk of breast cancer was going to increase by 26%. That's a lot. Since then, that study has been debunked. It was a false accusation. They skewed the data. It was misread and misinterpreted. We now know that women who take estrogen only actually decrease their risk of breast cancer. And most women, so if you have a uterus, you have to take estrogen with progesterone, because progesterone is what protects your uterine lining. Because if you take estrogen alone with a uterus, you actually increase your risk of endometrial cancer. So if you take them together, you mitigate and decrease that risk. But there's still a lot of worry about taking estrogen and progesterone together. We now know that if you take the synthetic progesterone and estrogen, your risk of breast cancer increases like 1 in 1,000. And I'm here to tell you that if you consume 1 drink per day, your risk increases way higher, 10 to 15% more likely to get breast cancer than 1 in 1,000 if you're taking the synthetic progesterone and estrogen together. Mostly what is used now is micronized progesterone, so like a bioidentical progesterone and estrogen together. Most of the time it isn't that synthetic progesterone. I just wanted to try to bring some clarity around that, because I think we're starting to hear the message that estrogen is safe, but people are still wondering about what about estrogen and progesterone combined, because that's often how it is prescribed. Your other option, estrogen, an estrogen supplement, whether it's transdermal through the patch or cream or oral, and a IUD. So IUDs are protective of your uterine lining. So you have options, and I want to keep talking about this because I know that study has created so much fear around hormone replacement therapy. And when I think about hormone replacement therapy, I think about living your best life in terms of mitigating symptoms, but I also think about longevity, and we all want to be here a long time. And we know that hormone replacement therapy decreases our risk of osteoporosis, and it decreases our risk of cardiovascular disease, and it protects our brain. So it's something that you should think about and should consider, along with all the other facets of health. So diet, movement, stress, sleep, all of those things. And I'll keep talking about it on this channel, but I just wanted to start the conversation. I hope you found this helpful.